Well, good morning, everyone. So we're going to do the praise and repeat similar to what we did yesterday. Can we say good morning again? I am super excited to represent the Multicultural Health Equity Collective this morning. Thank you all for being here, both in person and virtually. My name is Melissa Bishop Murphy. I'm Senior Director of Government Relations and Multicultural Affairs at Pfizer, and I co-lead the Multicultural Health Equity Collective with Naisha Foster, who you will hear from today. So before we start, we first want to acknowledge, honor, and respect the diverse indigenous peoples connected to this land, before and after the removal and colonization of its native peoples. Today, 39 tribal nations dwell in the state of Oklahoma, and we fully recognize and support their sovereign rights. And we were so happy to partner throughout this journey in making the summit happen with two of those nations. We selected Oklahoma City as the location for our second Health Equity in Action Summit with purpose. As we further explore the systemic issues that affect the health underrepresented communities, we need to be mindful to address the health inequities challenging tribal nations. I want to thank the leaders from the Cherokee and Osage nations in particular for their participation, as well as so many other partners who are joining us today. I also thank all of you for joining us today, whether you're in person or virtually. For those who are participating virtually, you will have the opportunity to be interactive with us here in the room. You will have the ability to answer questions at each session. In particular, I want to thank our co-convening partners. We could not have done this summit without you. They are the National Caucus of Native American State Legislators, Morehouse School of Medicine, the National Association of County and City Health Officials, and the Century Foundation. Let's give them a round of applause. As I mentioned earlier, this is our second Health Equity Summit. The inaugural summit took place in my hometown of Atlanta, Georgia in 2022 and resulted in the publication last year of an action guide to disrupt inequitable health outcomes. It was a community-developed tool providing informative cases, actionable steps, and practical resources for those seeking to drive greater health equity. The guide has been distributed widely through media sources, partner events, and thank you for our partners in the room who have distributed the guide, and other activities. And we have received positive feedback from various sources on its use by local organizations and partners to help drive health equity action. For any of you who have not yet seen or perused the guide, you can download it by scanning the QR code that you're seeing now. This year's summit theme, Communities Forward, brings together, once again, experts from across the multiple sectors of the healthcare ecosystem and community health and service leaders to share insights and perspectives on how to shape and scale effective and innovative solutions to address critical gaps in equitable access and improve population health. And if the speakers are anything like the speakers yesterday, we are going to have a fabulous day. It is imperative that we continue on this mission. Beyond the moral implications, the economic burden of racial and ethnic health inequities in the U.S. in 2018, prior to the pandemic, was estimated to be over $1 trillion. So the work we do here today is vitally important, not just for our communities, but for the nation. And we are reconvening here at an auspicious time. Not only is it right before a very consequential presidential election, but just shortly after the National Academies of Sciences, Engineering, and Medicine issued a 20-year update of its 2004 benchmark unequitable treatment report. This may be one of the first relevant nationwide leadership and community gatherings that can react to the findings and recommendations of that report entitled Ending Unequitable Treatment, Strategies to Achieve Equitable Health Care and Optimal Health for All. For those of you who have not read any part of that report, we hope that you will keep it in mind as you learn, connect, and sustain our progress towards the common goal of improving the health of historically underserved and marginalized communities. We know that achieving our goal of health equity is complex and long-term, but by supporting these gatherings, we hope to facilitate the identification of strategies and tactics that can help us get there. One of the major findings of the Unequitable Treatment Report is that there is substantial evidence of community-based solutions that work to help close the gap in health equity. However, we have failed as a nation to scale these community-based solutions to a sustainable impact on healthcare systems. But I think all of you in the room can change that because you're doing the work every day. Yet while we are here on very serious business, we also want you to have fun, right? So connect, engage with each other, share stories, and explore new opportunities to work together. We want you to learn, connect, and help sustain our work today and into the future. As part of the fun, we have a photo booth experience where you can share photos that you might take today on a social wall. Simply scan the QR code to gain access to it. Our sessions today are focused on 4 priority tracks that were identified by healthcare provider partners, including the National Black Nurses Association, the National Association of Hispanic Nurses, the National Hispanic Medical Association, and the National Medical Association. If representatives are in this room from those 4 organizations, please stand so we can recognize you. By responding to the 2021 survey, the membership of those organizations helped us identify 4 critical areas for impact. 1, healthcare facilities and delivery, policy, research and data, and workforce pathways. We want every session today to make relevant issues clear, drive the discussion towards scaling and adapting solutions, and engage all of you to provide other innovative recommendations. Our intention is to utilize your recommendations that are generated to develop future initiatives that can also help drive these goals. We believe that by continuing to work together, we can help on the issues and advocate for solutions to create change. We will be asking you to evaluate how we did today by asking you to take a brief survey at the end of the day, and we hope you all will have the opportunity to complete the survey to help us continue developing future convenings. This year, we added a day to the summit to support high school, college, and medical students from the Oklahoma City area to learn more about the wide range of health careers and provide resources to facilitate their career path. How many of you were able to attend our Rising Leaders in Healthcare Day yesterday? Wonderful. Thank you so much for your participation. It was, I don't know about you, but it was such a moving and special day. I mean, I was just blown away by the facilitators' stories and really drove the message that if you really want to do something, you really can. We hope that having days like we did yesterday will help fill the workforce gaps we're experiencing in the various sectors of the healthcare industry today. And we look forward to talking to you about how we can pull through some of the information we heard yesterday. So thank you all for those who participated as facilitators for the Rising Leaders part of the summit.